March is National Colorectal Cancer Awareness Month, and experts at ThedaCare are hoping to see more young people take interest in early screenings. According to the American Cancer Society, 1 in 5 diagnosed cases are found in patients under the age of 55. While overall case rates have gone down over the past decade, rates in young people have gone up about 2% each year. Dr. Amber Bista says there are a variety of factors that are contributing to that increase, like genetics, diet, lifestyle, and activity level.
Some parts where the risks or the increase may not be as much, but definitely we have seen a definitely significant rise in the younger people in the Western world.
The general recommendation for those at average risk is to begin screening at age 45, and depending on your risk factors, you may need to get follow-up screenings every 1 to 3 years.